We'll come back to Tuba later in the bulletin. The lack of sexual and reproductive health services in schools has left teenagers vulnerable to the risk of HIV infections. Now, Doctors Without Borders has appealed to the Basic Education Department to speed up its rollout of sexual and reproductive health services to high school pupils. ENCA's Yanka Tolme is tracking that story for us. Yanka is live with me in studio this morning. And Yanka, let's pick up on the guidelines. What exactly do they say and why are they so important?
Well, the Department of Basic Education adopted the national policy on HIV, STI and TB back in 2017. And what this said is that learners should and would be able to receive sexual and reproductive health services on school premises. But 2 years later now, Doctors Without Borders raised concern because the department did not release these guidelines yet that would just basically say how these services would be offered on school grounds. You have to imagine these are quite delicate and sensitive processes when it comes to HIV testing, permission from parents to test the learners specifically because they're still under 18, and when it comes to counselling and so on, it is quite a sensitive process. But what the Doctors Without Borders was saying is that they said that this process of releasing these guidelines has been basically put on hold for 2 years. And this means that they couldn't, in their experience, go onto the school grounds. And it makes it easier for them, they say, because learners can go and do it on school premises instead of having to go to health facilities after school and then rush to health facilities that are not close. And they also said that that leaves questions around confidentiality if they have to go after school to different health facilities.
But the Basic Education Department, in responding to Doctors Without Borders' position, is saying, in fact, that the process has not stalled for 2 years and work has been done. So why has there been this confusion in the two versions?
Well, it was interesting because Doctors Without Borders released this statement on Thursday. Yesterday, the Department of Education did respond, saying that actually this process is quite complex, but it is already on school advocacy and implementation level. And according to them, to the department, that is, these guidelines will be released next week. What MSF then again responded as well, saying the fact that they welcome this, but they still the fact is it's been 2 years since this policy has been adopted and it hasn't been implemented, which they say puts learners at risk because they're not being tested and they're not receiving counselling on school premises, and they found that that is preferred when it comes to learners. Unfortunately, the department just says that it is quite complex. They're saying that 2 years for a policy, according to them, is actually quite not that long if you can consider the processes that needs to be followed. That's from consultation, then going back to the different stakeholders, getting permission from parents and so on. So they're saying 2 years is not that long when it comes to policy. They say that work has been ongoing and that these guidelines will be released next week. Obviously,
let's talk process then, because if these guidelines are to be released next week, what happens once they're published?
Well, what they're saying is then within the timelines that these guidelines give, work can then actually start, and these services can then be given or rendered to the learners on school premises. Basically, both parties want to ensure that the learners are safe, they are educated and tested for HIV, STIs and TB. What the department is just saying that work has been ongoing. MSF said that it's been 2 years and they wanted to be published as soon as possible so they can start their work. So once these are now released, then those will be distributed to the different provincial governments and the districts, which will then give them guidelines as to how these services can then, as soon as possible, be rendered to the learners on school grounds.
Yanka Tolme, thank you.